Stemcord is the leader in the field of cord blood banking. Founded by a team of renowned medical doctors, Stemcord is committed to offer families hope for the future by providing them with the opportunity to bank their newborn's cord blood as an option for the treatment of future diseases. In recent years, there's been an explosion of breakthroughs in the field of stem cell research. The tissue and lining of the umbilical cord are found to have an abundance of mesenchymal stem cells that have the power to regenerate other cells, as well as create structural and connective tissues such as heart, nerve, cartilage, bone, muscle, liver, and fat tissue. Stemcord now offers cord stem cells banking for the storage of these mesenchymal stem cells on a research clinical trial basis, so that families are able to tap on the next scientific breakthrough. Being rich in different types of stem cells, cord blood and cord stem cells may help to repair the body in different ways. It is important to note that while there are potential uses for stem cells, the use of cord blood and cord stem cells for some emerging treatments is experimental. Storing both cord blood and cord stem cells can comprehensively protect your child and family's health.
With the potential to treat a wide range of diseases, including common cancers and blood disorders, cord blood and cord stem cells represent a form of biological insurance.
Stemcord cord blood banking process is simple. At enrollment, a Stemcord cord blood and cord stem cells collection box will be given to expectant parents to bring along with them to the hospital on the day of delivery. Upon admission, the nurse in charge will prepare a Stemcord cord blood collection kit. For parents who opt for cord stem cells collection, it will be indicated on the collection box. The nurse in charge will prepare a Stemcord cord stem cells collection kit. Stemcord adheres to stringent criteria to ensure proper storage of the cord blood collection kit. It is placed in a temperature-controlled environment at the hospital and is monitored daily to protect the integrity and functionality of the cord blood collection kit. Inside every Stemcord cord blood and cord stem cells collection kit, you will have all items needed to perform cord blood and cord stem cells collection. The collection of cord blood is a safe, painless and quick procedure done immediately after the baby has been delivered. Cord blood should be collected while the placenta is still in utero, in situations where there is no danger to the mother or baby and where gestation age is at least 34 weeks. The cord blood will be collected after the safe delivery of the baby and the placenta still in utero. The doctor will clamp and cut the umbilical cord. If cord stem cells collection is also requested, it should be performed after the collection of cord blood. 2 full 8 milliliter tubes and 1 3 milliliter EDTA tube of maternal blood will need to be drawn before or after the child's birth. The cord blood and cord stem cells will be sent for a series of laboratory tests. For private hospitals, the Stemcord collection box is placed into the storage container provided by Stemcord at the delivery suite. The mother's details is labeled onto the record booklet together with the date of birth of the child. Stemcord personnel will pick up the cord blood and cord stem cells from the designated areas in the hospitals daily. As for restructured hospitals, the cord blood and the placenta, if cord stem cells collection was requested, will be returned to the parents after the delivery. Parents are to inform Stemcord personnel to pick up the cord blood and the placenta immediately. The cord blood and cord stem cells are transported securely in a temperature-controlled environment back to Stemcord's laboratory for testing, processing and storage under the most stringent conditions. Stemcord ensures that the highest standards are adhered to in terms of processing and quality control, so as to ensure that the cord blood and cord stem cells are safe and viable for treatment. Stemcord labels each cord blood and cord stem cells unit with the client's unique identifier, using the ISBT 128 standard for cellular therapy coding and labeling. For cord stem cells banking, the collected umbilical cord is processed and segmented into smaller pieces. Stringent processing takes place to extract all cord stem cells prior to cryopreservation. Research shows that extracting the stem cells before storage increases cell yield 8 times more than the cell yield from frozen tissue. In addition, while cells extracted from frozen cord stem cells exhibited functional recovery, there were poor cell recoveries, decreased plating efficiency, increased doubling times, and slower growth characteristics. The cord stem cells can be further multiplied with the culturing process in the future. This is especially so if the therapy requires larger doses of cord stem cells. Cord stem cells research is still at an early phase, and it's crucial to preserve all stem cells within the cord region to maximize the potential for your family's future use. Stemcord is the leading cord blood bank in Singapore that stores cord blood in 2 cryo bags.
Your baby stem cells are stored in multiple cryo bags in 2 separate locations. This will give you the flexibility to use the stem cells more than once, thus maximizing the potential of multiple therapies. We have backup generators and a 24-hour monitoring system, thus making our storage system a very secure one.
Stemcord has a track record in the release of the stem cells unit for treatments.
The founding members of Stemcord are doctors, and as such, our founding values reflect that of a doctor, and that is to serve humanity. We build our foundation on a reliable, professional, and affordable service to store your baby's stem cells.
Storing your baby's stem cells is a long-term commitment, and it's important to choose a cord blood bank of high-quality standards to protect the viability of the stem cells you've entrusted to us. Stemcord is one of the few in Southeast Asia to hold the honor of being accredited by FACT Netcord, a prestigious international accrediting organization that addresses all quality aspects of cord blood collection, processing, testing, banking, selection, and release. FACT Netcord accreditation inspires confidence in patients and doctors that the cord blood units are of high quality.
Stem cells today have immense potential in treating cancers and blood disorders. There are also many clinical trials that are ongoing for regenerative therapy. However, these valuable resources are often wasted if the cord blood and cord stem cells are thrown away after delivery.
Stem cells stored today have the potential to be used as a life-saving treatment tomorrow. Stemcord provides hope for the future.